To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, it's March, and that means it's Colon Cancer Awareness Month. And to talk about that, we're joined by Dr. Tim Edison of Surgical Associates of Neenah. And doctor, let's get right into it. How often do we see colon cancer patients?
Currently, it is our second most common cause of cancer death for American men and third for American women. 150,000 new cases are diagnosed every year, kills 52,000 Americans yearly.
It's a mind-blowing stat, and we talked about earlier that the frustrating part of this is coming to symptoms, isn't it?
Absolutely true. Most of the time, people have no symptoms. When they do, we often see things like rectal bleeding or change in bowel habits. Anyone with those types of symptoms should alert their physician right away.
Right, and let's transition that into who is at most risk.
Unfortunately, everyone is at risk. Certainly factors like age, obesity, smoking will increase your risk. Anyone who has inflammatory bowel disease such as Crohn's disease, ulcerative colitis, African Americans are at higher risk as well, particularly people who have a family history of colon cancer or colon polyps. Increased risk. Screening in all these populations needs to start earlier than the traditional 50 years old.
Yeah, and let's talk about that. So on a normal person, what would that time frame be to start getting tested?
Typically age 50.
Okay.
Although it's interesting, two societies, including the American Cancer Society, have been recommending perhaps starting screening colonoscopy in average risk people age 45, something new this year.
Not bad to get it earlier, right?
Absolutely
So
not.
let's talk about that screening. What does screening look like?
So there's typically two modalities. One is a stool-based test at home. Stool specimens are analyzed for blood or genetic changes. The other method employs using a screening colonoscopy, which is a camera, flexible camera, put in the rectum, colon's examined, patient is sound asleep with sedation and comfortable.
And we talked about some of these at-home tests, but really colonoscopy is the way to
Absolutely
go.
the gold standard. The at-home stool tests are not a bad second choice. Colonoscopy, definitely gold standard. It is done once every 10 years. The at-home stool tests are every 1 to 3 years. Colonoscopy is the best test for detecting small precancerous polyps, which is what leads to colon cancer.
Well, with the stats that you said to lead the segment off, I think we can both agree that everybody, especially now in March, that colon cancer awareness month should get in and get tested. So, doctor, I want to thank you for this great information, and I want to thank you for watching To Your Health.
The preceding was a paid advertisement.